Hi there, Emily Yuri here with Fort Worth Moms, and we are continuing our Q&A series for Virtual Bloom 2021, an event for new and expecting moms. And for this session, I am very excited to have two doctors from My Texas Health, a local practice here in Tarrant County. We have Dr. Garda and Dr. Hurd with us. Hello, thank you for joining us.
Thank you, Emily.
Hi, happy to be here.
Yay. Before we dive into our questions, I have some housekeeping items I want to take care of. We do have some curated questions that we are going to be asking throughout this Q&A, but we will also take a minute to answer any questions that you might have, questions from our audience, so to speak. You can post those comments and questions just like you would post on any old Facebook post. StreamYard does want you to verify. So unless you just want to be known as Facebook user whenever it comes up, you just have to click that link, streamyard.com/Facebook, and then it will just show your name whenever you make your comment or your question. Also, this Q&A video, when we're finished, we will download that and include it in the Bloom Classroom, which is a page that we have on our website that has lots of webinars and workshops that tackle all kinds of issues from pregnancy, birth, postpartum, and to parenting that 0 to age 2 stage. So be sure to check that out. You can find it and rewatch this Q&A again there. And that concludes my housekeeping. Yes, I again want to say hello and welcome and a big thank you to Dr. Garda and Dr. Hurd for taking time from their afternoon to come and chat with us and answer all my questions. I mean, how fun is this? I just get to ask all the questions I want. And but more importantly, for supporting Fort Worth moms and supporting our Virtual Bloom event and offering your expertise and your resources and encouragement to our viewers today. So would you mind, Dr. Garda, we'll start with you. Would you mind to just tell a little bit about yourself, about your practice?
Yes, ma'am. Can you hear me okay?
Perfect.
Awesome. So I am a newcomer to My Texas Healthcare Group. Super excited to join this very awesome, diverse group of physicians with so much experience. I have come over from a prior practice in Fort Worth, and we'll have a sort of a dual role. One is heading up a new OBGYN residency that's starting at Baylor, and also part of this fantastic private practice, which is a smaller subset of Texas healthcare. So just excited to be here with you guys.
Awesome. All right, Dr. Hurd, you're up.
Great. Well, I'm going to start even further back. As I was telling Emily before we started, I grew up in the Tanglewood area, and I think this group kind of had a genesis out of that area. Is that correct, Emily? The Fort Worth moms and the Tanglewood moms and all that?
No, we're not affiliated with Tanglewood Moms. Fort Worth Moms started back about 8 years ago, and we've kind of grown from our online kind of content production.
Good. Well, and I've been here in Fort Worth, back in Fort Worth after college, medical school, residency since '91. So we started over at Harris, and then we moved over to, at that time, just Baylor All Saints, and now it's Baylor Scott and White All Saints in 2008 when we built the brand new Andrews Women's Hospital. And so we welcome Jackie into our group, and we welcome hopefully the residents a year and a few months from now. And very happy to help out and answer any questions.
Excellent. Well, I have a lot of questions. We did a bit of kind of polling of some of our readers and brainstorming. And as we started thinking about it, you know, we realized that rightfully so, pregnancy in mom circles gets a lot of the spotlight. And even in I even think like pop culture, there's a lot of support, a lot of information about pregnancy. But the postpartum stage is kind of under discussed. And I think some of that practically comes from moms are then in the midst of taking care of the newborn babies and dealing with the healing of their bodies and all that comes with that. And there's some isolation, and there just isn't kind of a natural discussion and freedom. So I wanted to ask, based on y'all's experience, what would you want women to most know about their postpartum health?
Jackie, you want to go first?
Sure. Thanks, Jay. One of the things I think that it's important to recognize is that this postpartum phase is a critical phase. And for many people, I think the world, the media perception would have you think that it's going to be easy and you're going to be frolicking in the fields with your baby and your husband and you're happy. And the truth is you might feel that way, but you also are going to be sleep deprived, striving to get your figure back, emotional, sometimes so exhausted, it's difficult to feel like you can pull yourself together. And what I want to say is you're not alone. This is a normal process. And it's something that you can manage and that you can manage in conjunction with your healthcare provider. And I think everyone needs to know that is normal as well. Normal doesn't mean easy, but it's something that can be managed. And, that's something that absolutely we shouldn't feel that we're weak or lesser, that we're not a good mother or a good spouse because of those struggles that people have. And you're not alone in it, certainly. And I'm so happy that we're talking about this topic. So important. How about you, Jay?
Yes, definitely. And I think it should start even before you deliver in prenatal care. And I often will talk with my patients, especially if they've had issues before pregnancy and been on any kind of medicines for any sort of anxiety, depression. I will warn them. I said, there's a good chance postpartum, it may get worse. I want you to call. Don't wait for your 6-week checkup. We used to just click a box and say, at 6 weeks, we'll see you. Now, our society, American College of OBGYN, says we really should be in touch with people, maybe even just by phone, or now with all these new different types of media that we can get in touch with people and talk about these things, because we screen people before they leave Andrews Women's Hospital with a postpartum depression screen. We screen them again when they come in for their postpartum, but sometimes we need to be talking to them before that and starting things, talking to them about them, giving them options. And it is a team effort often. So involving the other father of the baby or whoever that's involved is important.
Yeah, absolutely. Whether or not you qualify for the definition of postpartum depression, those changes that occur, not just physically, but in your routine, in your schedule, in your sleep, but in your whole life really changes. And that can be, unsettling for anyone, dads included. They have their own postpartum seasons. So we know that it is normal. And I liked what you said, just because it's normal and common doesn't make it easy. But what would you say, what are some, for lack of a better word, signs and symptoms for when a new mom knows that they maybe need to seek some support outside of the home, from their doctors, not wait for that 6 week or wait for y'all to take the initiative? When do they need to say, okay, here's my sign and symptom and I need to reach out for help?
Jackie, you want to start again first?
Sure. There is a whole lot of iterations or grades of feelings in the way that people experience this period of postpartum. So you don't have to wait to get to the point where you feel like you can't function. Feelings of sadness, even euphoria or rapid cycling of your moods, not sleeping. You're not sleeping anyway when you're a postpartum mom, because you're getting up to feed. But when you get a chance to rest, not being able to, feelings of hopelessness, feelings that you can't see any joy in your life, or just feeling less than, or you're not quite, you're feeling perfect. But even if you just start to have, I always tell patients, you start to have more bad days than good days, please come back. And when you see your doctor for that 1 week or 2 week postpartum check, you might not feel so great in a week to 10 days. And so we're always there for you. So always open lines of communication, and know that this is a safe place to talk about those feelings that you're experiencing. Jay?
Yeah, sure. Everybody responds to the normal physiologic changes in hormones postpartum differently. And some moms just have mild baby blues. Some moms can score on one of our depression scales pretty high, but still say they're getting better and they want to do it just, naturally. And other moms are feeling overwhelmed with even lower scores. So I don't think you can go on just a scoring system. It's a discussion and the pros and cons of what can be done. And often it's just explain to the women that this is a normal process. I mean, you can have a normal process that needs help, and you can have a normal process that you don't need help with medicines, but also with counseling and with just talking about it. That often helps. And getting, like I said before, it's very important to get the other caregivers involved with helping out, getting some mommy time where they're not doing everything else.
I just want to add one more thing as well. And the people who are closest to you in your life, you may be so overwhelmed in the experience and the adjustment of becoming a new mom, or becoming a mom of 2 or a mom of 3. Each time is a different experience. But sometimes the best indicator is the people who love you and see you. And they might say, I'm worried about you. And I think that's a powerful thing to remember, that the people who love you are vested in your wellness and may have a better kind of view of how you're experiencing things objectively. So listen to them. Not that that's the only thing, but it might be a powerful indicator.
Yeah, I think that is a great tip, because sometimes when we are in the middle of the changing, the feedings, the rocking, in the case when you add children, still feeding your toddlers, still disciplining, still trying to do some work, all those things, that we can lose sight maybe of where we are on that scale, and listening to the ones who love you the most. That is like a really great tip, because sometimes they can maybe help push us in the direction we need to go. What would you say, I feel like forever, like the postpartum recommendations have been really similar. And Dr. Hurd, you kind of indicated, it used to be you didn't follow up for 6 weeks. But how have things changed in that regard in recent years? Even what are your recommendations for, resuming birth control? You have to start thinking about conception issues not that long after you've given birth. How have those recommendations changed? Considering pregnancies again, sexual activity. What are the recommendations now?
So it seems, and Jackie, correct me if I'm wrong, our American College of OBGYN maybe 3 years ago came out and said, the old 6-week check, it should not be it. We have to individualize. Some sort of contact within the first 2 to 3 weeks, be it by phone, be it by a visit, just making our offices available, especially in women who have chronic medical conditions like hypertension, diabetes, those kind of things, but even just for the emotional support in a healthy woman. So it's kind of going the way most of medicine is personalized medicine or individualized medicine, and not just following a cookie cutter.
I would agree. Really, it is an individual experience. And so for standard, I'll sometimes say 2 and 6 weeks, let's see each other. But that's if everything's perfectly normal. You had medical issues, you had symptoms of baby blues or depression. We follow what the patient needs, and we put the patient first, or that's what we try to do and individualize it. So.
Yeah, we have a question that came through here that kind of pertains to what we're talking to. What's the recommended length of time to get pregnant again after a C-section? Does that vary from vaginal birth?
Jay, you want to take that one?
Sure. Yes, it does. There is no set time, but when you've got an incision on the uterus, I want them not to be trying to get pregnant for at least 6 to 9 months. Whereas with a vaginal delivery, you could maybe do it sooner, but it's still not even recommended to do that. Your body needs to heal. You emotionally need to heal. You need to be doing that. That's why you were talking about contraception is so important. And it needs to be stressed before they leave the hospital. And unfortunately, for the first few weeks, that's abstinence because things have to heal. But then they need to be ready to talk about what they do want to use when they come back for either their 3-week, 2-week, 3-week, or 6-week. I typically start them on something at the 6-week visit. And if they're breastfeeding, it can be a progestin-only pill. It can be long-acting reversible contraceptives like the intrauterine devices, implants in the arm. I mean, there's all kinds of options, and all of them have pros and cons, and it's a discussion to be had.
Absolutely. I mean, ideally, also one factor that we always think about is if you had a C-section and for your next pregnancy, you may want to try for a vaginal delivery or trial of labor after cesarean, we called it TOLAC. We'd want you to have at least 18 months before you go through another labor to decrease the incidence of uterine rupture. So, I mean, that's one other caveat. And certainly time to heal, time to adjust with your new baby and your, the way that it changes your whole family dynamic is good advice. So that's what we usually recommend.
Good tips for sure. I would like for you and I will kind of give everyone the warning here. We're about to ask our last curated question. So if you have a question you want to ask the doctors, go ahead and put that in the comments. I see a few coming. But my last question that I want to ask, can you just tell us a little bit about maybe your practice's philosophy? Like, what is important to you in that doctor-patient relationship? Like, if people would be looking to you to maybe, come to you for your services and your help, like, what are they going to find at your practice?
Well, I'll start with mine. Is trust and openness. I want them to feel totally, free to say whatever they want, and I like to be upfront talking about things and educating as we go. I don't like to just keep things quiet. So I guess that's my biggest, feeling. Jackie?
Yeah, I mean, exactly. For me, the patient-centered relationship is everything. And until we have trust, I really don't believe that great care can happen. I want patients to feel comfortable to talk to me about anything and know that I come at this as a mother of 4 sons and as a daughter. My parents had 6 daughters, and so women's health to me is so very important, and I feel so privileged to be able to provide care to patients. And so just to know that their needs will come first, and in a environment that's compassionate and caring.
Yeah, and feel free to call us too. I mean, we have long-standing relationships. My nurse Trish has been with me for 29 years now. So we've cared for many parents that delivered their babies, now deliver babies to those young women. Sorry. And
they'll always be our babies, don't they?
It's true.
Yes. Okay, there are a couple questions popped up. I'm going to ask from the ladies who are viewing right now. And one is, can you have a vaginal delivery after 2 or more C-sections? There's a lot of questions kind of wanting to get into what does delivery look like after you have had C-sections.
Jackie, you want to take that?
Sure, yeah, absolutely. So the American College of OBGYN came out with a position paper a few years back. And the big risk of trying for a vaginal delivery after cesarean is uterine rupture. This is a catastrophic event that thankfully we rarely see. The rate of this we think is about 1 to 2%, which means 98 to 99% chance it will not happen. So while medicine is an art and a science, you will have to talk to your practitioner about their views on that. We as physicians, some physicians are very open to trying for a vaginal delivery after 2 prior cesareans. Others don't really agree with that position statement. And so again, this goes back to the relationship with your physician and the trust that you have. And so also there are other online perinatal calculators which talk about the likelihood of success, which sort of factors into that decision. Which if you had a C-section because you were breech versus you labored and never dilated past 4, that sort of tips the scales on the likelihood of this. Also, we consider medical conditions that may hinder your chance for success. So again, it requires a very detailed discussion with your provider.
Yeah, the past history is important. So if this is a mom who's had a vaginal delivery and then she had a C-section because of breech and another one because of breech, and she was head down, and if we're the ones that did the breech C-sections and we know the uterus wasn't thinned and everything was normal, then sure, I would be happy to have them undergo a TOLAC or VBAC. Those are all acronyms we use, a trial of labor after cesarean or vaginal birth after cesarean. But they also understand, like Jackie said, the 1 to 2% rupture rate goes up if you use things like prostaglandins to ripen the cervix or Pitocin to augment labor. So usually we like for them to just go natural in the form of not inducing labor. They can still have an epidural. But so those are all things we get to get the operative notes. If we didn't do the C-section, we have to know their history and they have to be counseled appropriately.
So many things to consider.
Mm-hmm.
Last question. This is for real. Actually, the last question I'm going to ask. Okay, so maternal mortality has been an issue that has been in the news of late, and Texas has not always scored really well in that arena. So what is your practice specifically doing to help lower that number and better serve the communities where those numbers are highest?
I'll defer to Jackie to start again.
Well, I know just from kind of going through some of these that some of the highest zip codes of maternal mortality exist around the Dallas-Fort Worth area. And that's certainly an issue that is near and dear to our hearts. Thankfully, it is a rare occurrence because it is always catastrophic. I think that this past year has also made us as practitioners extremely sensitive with COVID and the challenges that we faced in a different way. I've certainly been humbled and grateful to be a part of such a great team of doctors and also nurses at Andrews Women's Hospital. The communication is exceptional. And the care that we can provide as an experienced team is certainly that as well. So again, I think it goes back to what we said earlier. Taking care of each patient, one patient at a time, is the most important thing we can do as providers to help. I always say healthy mom, healthy baby is our goal. And whatever we can do to both provide exceptional, patient service, but also a healthy baby. We are always mindful we have 2 patients and we do the best we can to provide the best care possible.
Yeah, and I think preconceptional care, Emily, is very, very important because some of these moms may not know that they need to be counseled before they get pregnant if they have a certain heart condition. Because the maternal mortality goes up with certain types of heart conditions, even if they seemed healthy. And so that's important to counsel them. And then, like Jackie said, our nurses and our hospital system practice certain things all the time to deal with critical events like amniotic fluid embolism or pulmonary embolism. We had in the last year a young, healthy lady that developed a severe, critical saddle pulmonary embolism and would have died, except that she happened to be still in the hospital, and our cardiovascular surgeon was around and was able to save her life. So we're very fortunate to have our nurses that recognize things, and the ancillary services, the ICUs, the cardiovascular surgeons, all those close by.
I'd like to also add that for many young, healthy women, the first time they really see a doctor regularly is when they get pregnant. And so sometimes we do discover these things, hopefully before they get pregnant, but oftentimes when they're pregnant. So it's a really good lesson for all of us to always be vigilant for those types of things.
Yes, thank you so much. Great tips for sure. And we have the website there, mytexashealthcareobgyn.com, and that's where you can find more ways to get in touch with Dr. Garda and Dr. Hurd. Thank you again for answering all my questions and for taking time out of your afternoon and for supporting Bloom 2021 and Fort Worth Moms. We will be downloading this and putting it in the Bloom classroom for viewing later. But thank you and have a great afternoon.
Thank you for having me. Thank you.
See ya.